Hi guys, welcome back to my channel. Saya tahu dah lama sangat saya dah tak buat video kat YouTube ni. Saya nak record video guna phone saya, tapi dia tak cukup storage, so I cannot record for longer videos. And I cannot do anything about it. It's a sign for me to buy a new phone, but I don't have the money to buy a new phone. Anyway, I'm recording right now using my iPad, but it's the best choice I have for now. So ever since that I couldn't record videos, I have been posting a lot on my TikTok account. If you haven't followed my TikTok account, it is called Green Tea. So far, I finished my first posting, which is the internal medicine posting, and this is my first day of surgery posting. So for internal medicine, for me it's very interesting sebab dia cover a lot of system, cardio, respi, nephrology, neurology and all that. Benda tu memang best belajar, tapi dia sangat susah sebab there are a lot of things going on and you have to remember like a lot of them. If I have to be very honest, I was not coping well in medical school. I mean, specifically my first posting, because most of the time I am alone if I do not have classes with my supervisor, because my friends in another course or in the same course but different year, or in the same year but different posting, or if same posting different group. There are also personal challenges for me, such as I always feel like I'm behind compared to my batchmate. I always feel like I do not learn enough compared to them. I feel like I'm stupid among my batchmate. Like, for real rasa stupid sebab imagine you are in a group discussion with your supervisor, and then your supervisor asks you question, especially when the supervisor specifically asks you a question and I couldn't even answer, even though that question is kind of basic. But I'm not sure that if I couldn't answer the question because I do not know or because I was too anxious. But I feel like it's more to because I don't know at that time. I haven't learned about it. My group mates, they already like ahead of me, so they already know what's the answer for that question. I'm someone who like excel more in things like theory, clinical examination, like doing the physical examination of the patient. I'm very bad at that. I just cannot get the flow to be like incorporated into my mind so that it can becomes automatic for me. Every time when I try to do physical examination to the patient, especially in front of my group mate or my supervisor, I become anxious. So everything becomes so messy, and it's like I never do the physical examination before, even though I have done it multiple times. I really have to control my anxiety, but I'm still trying, and it's not easy for me to do that because it's so different compared to the lifestyle that we are dah biasa waktu dulu. Like contohnya daripada zaman sekolah, kita datang kelas, study, we just study what we learn in class and then excel in our exam. Medical school still ada macam belajar physical examination, like you still have OSCE, but it's kind of different compared to clinical. It is very different for me. So right now, why don't I tell you guys my experience of taking my first end of posting exam, and my impression of that exam is horrible. I was crying a lot. I was in a lot of stress. Until now, I haven't moved on. I still feel like I'm a failure. Like clinical medical school is just not for me. I don't want to quit, but maybe I'm not deserve enough to be in medical field. The reason why I said that because my first day of exam is theory exam. Theory exam is fine. Like I said, I am much better at theory things instead of practical things. A few days after the theory exam, I had my clinical exam, which consists of one long case and two short cases. So the long cases means that you have to take history from the patient and also perform physical examination, and then you have to present it to your examiner. There were two examiners listening to your presentation. For short cases, you also have two examiners watching you doing the physical exam. You do not have to take history taking. You just do physical exam. So for the long case, I got it for my first station in clinical exam. It was pulmonary tuberculosis, I think. based on my history taking with that patient and so on. But at the time, I was honestly not sure if it could be tuberculosis or like pneumonia. When I tried to do the physical exam on the patient is simulated patient. I feel like I think I know that at that time. But when I did the physical exam on the patient, like we have the respiratory exam, but when I was doing that the chest expansion on that patient, even though I already asked the patient to breathe in normal people it's supposed to be like the chest expansion like this, okay, but for that patient that I got in my exam, there's like barely nothing, like literally nothing. I was like, my hand was not moving at all. Then I feel like okay, then I will try it many times to confirm if this patient actually have reduced chest expansion or not. So I did that 3 times, like 1 2 3 1 2 3 1 2 3 to confirm front and also at the back, and still get reduced chest expansion. So I was like, okay, what am I going to do now? Am I supposed to present that the patient have reduced chest expansion to the examiner, even though I know it is a simulated patient, so simulated patient supposed to be normal? I don't know. Besides from having reduced chest expansion, that patient also have reduced breath sound. Like I've heard many times with my own lungs and my friend's lung, when we breathe in, we can hear the breathing sound very clearly. When I try to do that on that patient, supposedly normal patient, I barely hear the breathing sound, like there's almost nothing. And I already asked the patient to breathe in, breathe out many times. I already confirmed in the front, I confirmed at the back, it's still reduced. But in the end, I decided to be honest and just say to the examiner that this patient have reduced chest expansion and reduced breath sound. And then the examiner asked me, okay, you said that the patient looks well and does not look in any respiratory distress, which is true. She looks normal. She does not have any breathing difficulty. So it doesn't really make sense that she have reduced chest expansion and reduced breath sound. But that's what I found. So I would decided to become honest with it. So at that time, I feel like I kind of regret being honest, but I'm not sure. I'm not sure if being honest is actually good or not, or maybe I should have been a little bit smart about it and just say this patient is normal. She does not have any abnormal finding in respiratory system. I still don't know if I fail or pass the exam. I have to warn you, I feel like I would fail, to be honest. Not just the physical exam part that I was struggling. The interview with the examiner also a big struggle. The examiner was bombarding me with questions that I barely have any answer to it. I tried my best, to be honest. Like I already read the whole book, like Oxford Clinical Handbook. Like I know you're supposed to read the textbook, but who really have the time to read the textbook, to be honest? So I gave my provisional diagnosis, which is tuberculosis, and then my differential diagnosis was pneumonia, asthma, malignancy. But then I already stated why I rule in and rule out my differential diagnosis. So the question that examiner asked me was, what is the difference between pneumonia and tuberculosis, which got me a little bit off guard. I actually could not recall what's the difference between pneumonia and tuberculosis, which is kind of bad it's kind of bad, to be honest, because you as a medical student, pneumonia and tuberculosis is kind of common in the community, in Malaysia at least. So you're supposed to know what's the difference between pneumonia and tuberculosis, and I couldn't even answer the question. Like I don't know if I couldn't answer the question because I really do not know, or I forgot because I was too anxious. Besides from that, the examiner kept asking me what are the investigation that I want to do for tuberculosis. Like I literally state a lot of investigation for tuberculosis, but the examiner doesn't seem that, I don't know, macam tak puas hati dengan jawapan tu. I literally said all the things that were in the Oxford Handbook. Like apa lagi yang terlepas, yang tak cakap lagi. Like I still do not know. And also another dumb thing is that examiner asked me, okay, what are the blood tests that you want to do on this patient? Then I said, okay, full blood count, anemia, infection, and then liver function test, and then renal profile. And then the examiner asked me, why do you want to do liver function test? Why do you want to do renal profile? I actually don't know why, to be honest. Since I do not know why, I couldn't justify why I want to do those investigations. So the examiner asked me what is in the liver function test and what is in renal profile. And another dumb thing, as a medical student, you're supposed to know, which I do not know about it. I forgot. So I just say that, okay, in renal profile, total protein, and then the examiner obviously like, total protein? Are you sure it's in renal profile? And then at that time when the examiner said that, then I'm like, oh no, it's supposed to be in liver function test because liver is the one creating the protein supposedly. So I think it's mostly due to my anxiety, so it made me forgot. And if you still don't think my performance is that bad, let me tell you one thing. My performance is that bad when one of the examiner who was asking me question gave up, like literally gave up, and asked the other examiner to take over the conversation, to take over the discussion, because she had enough with asking me question, but I couldn't answer confidently, I couldn't answer properly, I couldn't answer perfectly as she was expected from a medical student, which I totally understand about that. If I was an examiner, I will also feel disappointed with that student. I feel disappointed with myself, even though I tried my best. Like everyone knows that I study almost every day. I was willing to go to Loose Coffee every day, bayar mahal beli air, just so that I can have the motivation to study every day walaupun tengah burn out. I wonder if that even though I tried my best, even though I tried my hardest but still failed my exam, does it mean that I'm not meant for medical school, or am I not meant to be a doctor? Moving on to the short cases, like I said, I mentioned 2 short cases. So the first one I got is cardiovascular system, and the second one is respiratory system. So the first cardiovascular system, which is my biggest enemy because I have hearing loss. For example, mechanical heart valve, I think people who does not have any hearing loss could hear the clicking sound even without wearing the stethoscope. Like you can hear the clicking sound if you stand near to the patient in a quiet room, or you put your head near to the chest area, in the heart area, to hear the clicking sound. I tried doing that, standing near with the patient in a quiet room. I tried to move my head closer, my ear closer to the chest to hear the clicking sound, but I still can't. I didn't hear any clicking. I'm not sure if my findings are correct, but I was just being honest to the examiner, even though the findings are quite weird. But like people say, my senior said, my lecturer said, do not make up signs. If you make up signs, you will fail. That's the end of my cardiovascular system short case. Moving on to my second short case. This patient have finger clubbing. This patient have normal chest expansion, like she can really breathe in well. However, her chest expansion at the basal part, at the lower part, was reduced on the right side. So I was already suspecting something is wrong on the right side at the base. There is reduced percussion, like it's very dull on the right basal zone. So I know that something is clearly wrong there. I did an auscultation and also heard everything else normal except for the right basal zone. By the time I have done doing the auscultation, that's where I was called by the examiner so that they can ask me questions. When I wanted to present my findings, because the examiner asked me to, I was already very nervous, and because I was too anxious, I literally forgot the patient's name and also the patient's age. It will be not appropriate for me to ask the patient again in front of the examiner, so I just pretend like this patient have finger clubbing and blah 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 until to the part where I said there is reduced chest expansion, reduced breath sound, reduced percussion, dull percussion at the right basal zone. And then the examiner asked me what is the difference, what is the provisional diagnosis for this patient. I do not know. And then the examiner asked me, okay, what is the differential diagnosis? Then I said pneumonia, and the examiner asked me, are you sure it's pneumonia? Oh yeah, I forgot to tell you that I also heard fine crepitation at the right basal zone. Fine, it's not coarse, but it's fine crepitation. So when I said pneumonia, then the examiner just looked at me weirdly like, are you sure it's pneumonia? To be honest, when I answered pneumonia, I knew it was a wrong answer, but I was still trying to brainstorm what could be the other answer. I had a lot of anxiety at that time, so my brain is not coping that anxiety very well. So I gave out like pneumonia, tuberculosis, and then when I got to the point where I said pulmonary fibrosis, that's where the examiner asked me more questions about pulmonary fibrosis, because pulmonary fibrosis is under interstitial lung disease. So the examiner asked me what are the other examples of interstitial lung disease, which I also do not know because I only know pulmonary fibrosis and I do not know any other example. But thankfully at that time the timer rang. So yeah, that is my summary of internal medicine posting. I know this video is very long and I apologize for that, but I have a lot to say. Wish me luck for surgery posting. I hope I do not repeat the same mistake for surgery posting and will do better next time in my next exam.